I'm a neurologist and I'm a headache specialist, and let's talk about some rare migraine facts that you probably didn't know. So Alice in Wonderland is actually a syndrome that is migraine related. So if you know anything about the movie, it basically means that images can appear bigger, smaller, closer, and it's just due to some rare perceptual distortions. And this syndrome is actually migraine related, which is crazy to me. Abdominal migraine is a thing. It's more common in children, but it can be in adults, and it's basically persistent stomach pain, vomiting, nausea, and it's a migraine variant. And following that, cyclic vomiting syndrome is also pretty rare, but also related to migraine. It shares a lot of that hypothalamic dysfunction that we see in migraine. Some patients experience transient hearing loss or just feeling really full in their ear, which we call oral fullness. It's linked to brainstem sensory modulation changes, and it can be really annoying for patients. It's a rare type of migraine called hemiplegic migraine, and it basically mimics a stroke. So when this happens to you the first time, it's really scary because you think you're having a stroke, and one side of the entire body can be completely plegic, meaning there's no movement at all. And it can take days to weeks to recover from one of these, and it's usually due to an ion channel dysfunction. And some of this is genetic, and it can be genetically tested. There's another rare form of migraine called retinal migraine, and this is actually in the ICHD, and it basically means monoocular vision loss. So one eye has vision loss, and it's different from aura because when you close the eye that's affected with vision loss, your eyesight is completely normal in the other eye. But visual aura usually affects both visual fields. Migraine is linked with other neurologic sensitivity conditions. So we're talking about fibromyalgia, IBS, POTS, and they usually have both a lot of the time, especially my chronic migraine patients, which is terrible. Finally, migraine patients can be really temperature sensitive. So they're excessively sensitive to cold changes, weather changes, heat. It's also due to shifts in the autonomic nervous system. This is why migraine is one of the most complex neurological diseases. If we actually had the proper research and funding to research it as well as some other diseases, we would probably learn so much more. It can affect anything from head to toe. There's genes we can check for this. It runs in the family. There's channel ion dysfunctions like CACNA1A gene. There's just so much. So I just can't believe it's still so stigmatized. And this is why I picked this, because I knew this was going to be an ever-changing field. So if you think you have a symptom that might be related to your migraine, comment below and I'll let you know what I think.